So this exercise is called retraction. It's often the most useful exercise for neck pain. Frequently when the pain's referred out to one or both sides or into the shoulder blade, or if your problem is more severe, often the pain can go down your arm. So to do retraction, you can either do it in sitting or in standing. Sitting often makes it more practical. However, when you're sitting, if you do it with a slightly slouched position, the position to retract from will not be ideal. So if you're going to do it in sitting, ideally use a lumbar roll, which will mean that your sitting posture is nice and upright, or you can even use a roll towel if you don't have a lumbar roll. So to do the exercise, fix your eyes level ahead, and just retracting the neck. Now, if it's quite painful, often just go to the edge of the pain. If it's not all that painful, usually it's better if you push slightly further with each repetition. Now, if this exercise is appropriate for you, the exercise itself may be painful, but the pain should reduce with repetition or remain better after. And if you have referred symptoms out to the side or out into the shoulder blade or upper neck, they should be more centralised after. That would also indicate the exercise is appropriate. Now, even if you are getting relief from this exercise, frequently you'll need to add more pressure, called overpressure, to fully resolve the symptoms. So this can be done with one or two hands. So just at the end of that retraction, add pressure. More often, two hands will make it more effective. If rather than needing more pressure, the exercise is actually quite painful and you're struggling with the simple retraction, often if the pain itself is causing a pulling into the head or a lot of kind of upper trap area pain, if you place your hands on the neck muscles themselves, so kind of upper trap area, this will commonly get rid of that high amount of discomfort that some people experience. Another way to produce more pressure, apart from pushing on your shin this way, is if you can use a rolled towel. It almost gives you not just a push from the front, but a push from the back. So you can roll up the towel, place it in your upper back. Again, same movement of retraction. And adding the overpressure. Now with these exercises, it should become apparent relatively immediately if they're appropriate for you, with pain being relieved and movement being better immediately after. If it is responding as expected, usually doing these exercises every few hours by 10 to 12 repetitions should usually resolve your symptoms within 24 to 48 hours, or at least significantly reduce them.